Stand by, please. We will start shortly. So from Bath in England, the professor of and lecturer at the Faculty of Medicine, University of Exeter, Dr. Bharat Pankania. Welcome, Doctor, to Sky News Arabia. So we were not finished with the coronavirus, and then we are seeing this danger of the black fungus. What does the medicine know about it, and what is the truth about it?
So the black fungus that we are referring to is otherwise known as mucormycosis. Mucor is the black fungus, and it is common. It is common in people with badly controlled diabetes. So unfortunately, in India, we have a perfect storm. A lot of people with very poor control of their diabetes. Second thing, in India, it is often common to start treatment with steroids, either for their COVID infection or otherwise. And the third point is COVID disease. So the combination of diabetes, steroid therapy, and COVID disease is leading to an infection with mucormycosis. This is the black fungus.
So, doctor, is it confirmed that it touches the people who recover from corona?
Yes, indeed. So, of course, so people who have also recovered from COVID-19 disease, they have their immune system upset. On top of that, they have had many therapies with immune suppressing drugs, steroids, and out of control diabetes. All put together, you can get mucormycosis after you have recovered from COVID-19 disease.
So is it the cause of the medicine that the people are taking, or because they were infected, or when they were in the hospital in the intensive care? Because some reports, they said that it comes by using the moistures or the oxygen and so on. So what is the truth about it?
The truth is, it's a combination of factors all coming together. So when a person is immune suppressed, in other words, their immunity is not very good for whatever reason. Number one, steroid therapy. Number two, therapy for transplants, that sort of thing. And third, when you have COVID-19 disease, whenever your immunity is reduced, there is a chance for fungal infections to start growing, which is what we are seeing in India. And in India, we have a lot of people with very poor diabetes control. So diabetes control also reduces your immunity.
So do you think that this can propagate like the COVID-19? Is it infectious?
No, it's not infectious in that sense. But the people who will get infected are the ones who have very poor immune system. So it is a risk factor for people with poor immunity. And the solution is, please, in India, do not use steroids unless absolutely necessary, number one. Number two, starting immediately, make sure your diabetes is under better control. And number three, in India, we do a lot of polypharmacy, too many drugs, immune suppressants, steroids, so on, and then you have COVID disease. So if you stop doing all those things that lower your immunity and control your diabetes, you will be in a better place.
Dr. Pankania, how can we know the symptoms, the first symptoms that show on the humans?
So it presents in several parts of the body, and it often presents with fever and one side of your face swollen, and you will feel congestion in your facial area here. So we can have a lot of pain and tenderness if you have it in your what we call nasopharynx eye area, cerebral area. And then you can also have it as black spots on your skin. And you can also have it, which is difficult to diagnose, of course, is an infection in your lungs, or also an infection in your bowel, your gut. So you have an infection in many places and you have different signs and symptoms. But the common one is fever, pain, not well, one-sided facial swelling, black spots.
You talked, doctor, about a mixture of the medicines drugs that we can use to fight the black fungus. But do this need also maybe surgical operations?
Yes, they do. And sometimes there is no choice but to, for example, have a surgical intervention to remove the eye or to remove the nose or the operation in the sinuses. So it is very serious, and the fatality rate is also very high. It can reach 50%. So mucormycosis is very serious, and the best solution to mucormycosis is not to get it in the first place. Therefore, control your diabetes, don't take steroids, take your vaccination, don't get COVID-19 disease. That is the solution. By the time you need surgery, you are already in very big trouble.
You confirmed, Dr. Pankania, that this is not infectious like COVID-19, but at least inside India, do people know, do they have the knowledge, enough knowledge about this pandemic, the black fungus?
Yes, there is considerable knowledge and considerable anxiety in India, and I know that India has asked for additional supplies of antifungal drugs. And of course, if you think about it, if you have a patient with black fungus, i.e. mucormycosis, and you don't have proper infection control measures, and you have another patient next to you, they can also get infected because it is a fungus and it spreads by spores. So you have to be very careful with infection control. The trouble is the drugs to treat the fungal infection are not very good, and we haven't got many antifungal drugs on the market.
Thank you very much, Dr. Bharat Pankania. Thank you for your incitement. The professor and lecturer at the Faculty of Medicine, University of Exeter from Bath. Thank you.
Thank you.